Which of the following is the most common extraglandular manifestation of primary Sjogren syndrome? A. Arthralgia, arthritis. B. Lymphoma. C. Peripheral neuropathy. D. Raynaud's phenomenon. The most common extraglandular manifestation is arthritis or arthralgia. Raynaud's phenomenon is the second most common extraglandular site. Lung involvement and vasculitis are found in less than 20% of the case. Lymphoma, though a concerning and highly morbid condition, is relatively very rare. So, the most common extraglandular manifestation of primary Sjogren syndrome is A. Arthralgia, arthritis. Which one of the following clinical findings excludes the diagnosis of polymyositis? Polymyositis. A. Neck muscle involvement. B. Extraocular muscle involvement. C. Dysphagia. D. Abdominal muscle involvement. Now, polymyositis manifests as B. Extraocular muscle involvement is not, it excludes the diagnosis of dysphagia. The extraocular muscle involvement excludes the diagnosis of polymyositis. So the correct option here is B. Extraocular muscle involvement. Now let us move to the next question. Which one of the following condition is associated with normal anion gap metabolic acidosis? A. Cholera. B. Starvation. C. Lactic acidosis. D. Ethylene glycol poisoning. A normal anion gap metabolic acidosis is caused by loss of bicarbonate ion. There is a loss of bicarbonate with a reciprocal increase in chloride concentration. Loss of bicarbonate with increase in chloride concentration. This is also known as hyperchloremic acidosis. Normal anion gap metabolic acidosis is also known as hyperchloremic acidosis. It most commonly results from abnormal gastrointestinal or renal losses of bicarbonate. There is loss of bicarbonate and increase in chloride concentration. Hence, there is increase in chloride concentration, then it is known as hyperchloremic acidosis. It mostly results from abnormal gastrointestinal or renal losses of bicarbonate. Diarrhea is the most common cause of hyperchloremic metabolic acidosis. Now we all know that cholera is associated with massive diarrhea. The diarrheal fluid consists of small bowel, biliary, and pancreatic fluids. The diarrheal fluid consists of small bowel, biliary, pancreatic fluids which contain 20 to 50 milliequivalent of HCO3. This large loss of volume of fluid leads to hyperchloremic metabolic acidosis or normal anion gap metabolic acidosis. So four options here are given here: A. Cholera, B. Starvation, C. Lactic acidosis, D. Ethylene glycol poisoning. So the correct option here is A. Cholera. All of the following are neurological channelopathies: A. Episodic ataxia type 1, B. Spinocerebellar ataxia type 1, then familial hemiplegic migraine, he is not a neurological channelopathy. But spinocerebellar ataxia type 6 is a neurological channelopathy. What is channelopathy? Channelopathy refers to a wide variety of neurologic disease caused by dysfunction of ion channels in the excitable membrane. These are due to inherited mutation of gene encoding ion channel in muscle, neuron, and glia. Severe myoclonic epilepsy of infancy, episodic ataxia type 1, familial hemiplegic migraine, spinocerebellar ataxia type 6 are examples of neurologic channelopathy. So the correct option here is spinocerebellar ataxia type 1. Spinocerebellar ataxia type 1 is not a neurologic channelopathy. Spinocerebellar ataxia type 6 is a neurological channelopathy. Episodic ataxia type 1, familial hemiplegic migraine, hypokalemic periodic paralysis. These are all neurologic channelopathy. So the correct option here is spinocerebellar ataxia type 1. Most common identifiable cause of dilated cardiomyopathy: A. Alcoholism, B. Viral infection, A. Alcoholism, B. Viral infection, C. Myocardial ischemia, D. Myocarditis. Most common identifiable cause of most common identifiable cause of dilated cardiomyopathy. Most common identifiable cause of dilated cardiomyopathy is myocardial ischemia. Myocardial ischemia. Diagnostic feature in rheumatic heart disease is A. Aschoff nodule, B. McCallum patch, C. Adenocarcinoma, D. alveolar cell carcinoma. Aschoff bodies are focal inflammatory lesions that may be found in any of the three layers of heart, pericardium, myocardium, and endocardium, and during acute rheumatic fever. Bodies consist of foci of swollen eosinophilic collagen surrounded by lymphocytes, primarily T cells, occasional plasma cells, Aschoff giant cells. Aschoff giant cells, also known as macrophages of rheumatic fever. Anti-show cells. Anti-show cells are modified macrophages with abundant cytoplasm and central round to ovoid nuclei in which chromatin is disposed of in the central slender wavy ribble-like pattern, also known as caterpillar cells. So, Ascha body is pathognomic of rheumatic fever. Ascha bodies are focal inflammatory lesions that can be found in either myocardium, pericardium, or endocardium during acute rheumatic fever. Ascha body consists of foci of swollen eosinophilic collagen surrounded by lymphocytes, and primarily they are T cells. Occasionally, plasma cells, Aschoff giant cells, that is macrophages of rheumatic fever, anti-show cells can be seen. What are anti-show cells? Anti-show cells are modified macrophages with abundant cytoplasm and central round to ovoid nuclei in which the chromatin is disposed of in the central slender wave ribbon-like pattern, also called caterpillar cell. So the diagnostic feature in rheumatic heart disease is Aschoff nodule. A. A student unable to deliver a speech before audience is suffering from A. Social phobia, B. Obsessive compulsive disorder, C. Agoraphobia, D. Claustrophobia. So what do you think is the correct answer? Can you type in the chat box, please? Here the student has an irrational fear of situation, and it is the commonest type of phobia encountered in clinical practice. It is characterized by an irrational fear. This fear results this fear is morbid because number 1, this fear is irrational. The objects or situations do not produce fear in normal person. Number 2, the fear is out of proportion to dangerousness perceived by the affected person, and the affected person avoids the situation permanently. Number 3, the patient is unable to control the fear and is very distressed by it. So, number 1, the fear is irrational. The fear is out of proportion to the dangerousness perceived by the affected person. Number 3, the patient is unable to control the fear and is very distressed by it. Now, other types of common phobia are agoraphobia. Agoraphobia is a irrational fear of situation. Irrational fear of situation. Social phobia, there is irrational fear of one or more social or performance situation. In this, the person is concerned about negative evaluation or scrutiny by others. For example, public speaking, writing, eating in public, using public, feared social or performance situation may produce anxiety symptoms and even a panic attack. Panic attack. So the correct option here is social phobia. A. Chronic lymphocytic leukemia is associated with chronic lymphocytic leukemia is associated with A. Individuals more than 50 years of age. B. Mature small lymphocytes in peripheral smear. C. Hepatosplenomegaly and lymphadenopathy. D. All the above. Yeah, the cells of origin of chronic lymphocytic leukemia, also called small lymphocytic leukemia, sequencing has revealed that the Ig genes are center memory B cell or naive B cell. Memory B cell or CLL is commonly seen in individuals more than 50 years of age. CLL is commonly seen in individuals more than 50 years of age and are typically characterized by presence of increased number of mature small lymphocytes in peripheral smear. There is hepatosplenomegaly and lymphadenopathy. Hepatosplenomegaly and lymphadenopathy. The physical examination may be unremarkable, but common findings are hepatosplenomegaly, enlarged, non-tender, firm, mobile nodes in the cervical, axillary, and inguinal areas. Diagnostic criteria of CLL are absolute lymphocytosis, more than 30% lymphocytosis in a normocellular or hypercellular bone marrow, monoclonal B cells with low level of surface immunoglobulin. So the chronic lymphocytic leukemia is associated with individuals more than 50 years of age, mature small lymphocytes in peripheral smear, hepatosplenomegaly, and lymphadenopathy. So the correct option here is D, all of the above. Which of the following can cause delirium? A. Hypoxia. B. Barbiturates. C. Withdrawal. Alcohol withdrawal. D. All of the above. Important causes of delirium are trauma. Whenever there is a head injury or subdural hematoma, it can cause delirium. Infection, septicemia, pneumonia, endocarditis. Then metabolic, hypoxia, hypercapnia, uremia, CHF, hepatic failure, porphyria, metabolic acidosis or alcoholysis, water and electrolyte imbalance. Endocrine, hypo or hyperpituitarism, hypo or hyperthyroidism, hypo or hyperparathyroidism, hypo or hyperadrenalism. Drug intoxication, alcohol, barbiturate, tricyclic antidepressants, anticholinergic, anticonvulsant. Drug withdrawal, that is alcohol withdrawal, delirium tremens, sedatives, hypnotics. Nutritional deficiency, vitamin, thiamine, pyridoxine, niacin. Then others are post-operative seizures, sleep deprivation. Whenever there is sleep deprivation, it can cause delirium. So the things that can cause delirium are trauma, head injury, subdural hematoma, infection, septicemia, pneumonia, endocarditis, metabolic, hypoxia, hypercapnia, uremia, congestive heart failure, hepatic failure, porphyria, metabolic acidosis or alkalosis, water imbalance. Then endocrine, hypo or hyperpituitarism, hypo or hyperthyroidism, hypo or hyperparathyroidism. Then convulsions, drug withdrawal, alcohol, delirium, sedative withdrawals, hypnotic withdrawals, nutritious deficiency, vitamins, thiamine, pyridoxine, niacin, B12, folic acid, protein, others, sleep deprivation, post-operative, then seizures. So hypoxia, barbiturate, alcohol withdrawal can all cause delirium. So the correct option, all of the above. In Marfan syndrome, aortic aneurysm occurs commonly in what happens in Marfan syndrome? There is aortic aneurysm, and it occurs in four options are given: A. Ascending aorta, B. Descending aorta, C. Abdominal aorta, D. Arch of aorta. In Marfan syndrome, the majority of patients with Marfan syndrome have ascending aortic aneurysm formation as their initial vascular event with subsequent vascular problems involving primarily the descending aorta, thoracic aorta. Ascending aorta. So the correct option here is A, ascending aorta. A patient has right upper limb BP of 180 by 95 millimeter of mercury, left upper limb BP of right upper limb BP 180 by 95, left upper limb 130 by 90. He also has early diastolic murmur in right second intercostal space. Early diastolic murmur in right second intercostal space. Which of the following would be least likely associated with these findings? A. Aortic dissection. So clinical features of coarctation of aorta is coarctation of aorta. So the correct option here is coarctation of aorta. Coarctation of aorta is the sixth most common lesion in congenital heart disease. Most patients have a discrete narrowing of descending aorta at the insertion of ductus arteriosus. Preductal, it can be preductal or postductal. Clinical features of coarctation of aorta: infancy, closure of ductus produces severe obstruction. When there is a closure of ductus at 7 to 10 days, produces severe obstruction. Ductus arteriosus sometimes remains patent. At that time, there is differential cyanosis. When there is associated intracardiac defect is there, it is intracardiac defect is there, it is more severe early onset. Childhood, asymptomatic without associated significant lesion. There is hypertension, 90%, cardiomyopathy, 33%, rib notching, 15%. Hypertension, very common. Heart failure at 30 years of age. 30 years of age. So the correct option here is B, coarctation of aorta. Aspirin sensitive asthma is associated with A. Obesity, B. Urticaria, C. Nasal polyp, D. Extrinsic asthma. The correct option here is C. Nasal polyp. Infertility in Cartagena syndrome. Infertility in Cartagena syndrome. A. Oligospermia. B. Blockage of epididymis. Oligospermia. B. Blockage of epididymis. C. Asthenozoospermia. D. Undescended testis. The correct option here is asthenozoospermia. Sleep apnea is defined as sleep apnea is defined as A. Temporary pause lasting at least A. 40 seconds. B. 30 seconds. C. 20 seconds. And D. 10 seconds. Apnea is defined as cessation of breathing of airflow for 10 seconds or longer. 10 seconds or longer. So the correct option here is D. 10 seconds. Now apnea is of three types. Obstructive apnea. There is no airflow at nose or mouth, but there are persistent respiratory efforts. This is known as obstructive apnea. Central apnea, there is no airflow at the nose or mouth, as well as no respiratory effort. Mixed apnea. Apnea, there is a mixture of central and obstructive apnea features. So the correct option here is D, 10 seconds. A boy is suffering from acute pyelonephritis. The most specific, the most specific investigation is a boy suffering from acute pyelonephritis. The most specific investigation is A. Histopathological examination, B. Leukocyte esterase test, C. Nitrite test, D. Bacterial gram stain. Acute pyelonephritis is a bacterial infection causing inflammation of kidney and is the most common cause of kidney pyelonephritis, occur as a complication. So the correct option here is A. Histopathological examination. 12-year-old boy presented with gross hematuria with 80% dysmorphic RBCs. RBCs. 2 days after attack of upper respiratory tract infection. Diagnosis is A. Microangiopathic thrombotic anemia, B. IgA nephropathy, C. PSGN, D. minimal change disease. It is IgA nephropathy. Now, what are the clinical features of IgA nephropathy? It is more common in male, one in Asian population. Hematuria is visible within 24 hours of onset of symptom, differentiating in from 2 to 3 week delay between infection and subsequent hematuria in post-streptococcal glomerulonephritis. Nephrotic range proteinuria is uncommon until advanced or full-blown active mesangial proliferation glomerulonephritis is present. So the correct option here is IgA nephropathy. 12-year-old boy presented with gross hematuria just B. Root pain or midline back pain. C. Abnormal CSF. D. Sacral sparing. The correct option here is D. Sacral sparing. Sacral sparing. What happens in intramedullary and extramedullary syndromes are in extramedullary lesions, radicular pain is most prominent. There is early sacral sensory loss. Here they have given the option as sacral sparing. No, there is early sacral sensory loss. Spastic weakness, incontinence is there. Whereas in case of Intramedullary lesions, there is poorly localized burning pain rather than radicular pain, and spare sensation in the perianal and sacral areas. So in intramedullary lesions, there is sacral sparing, whereas in extramedullary lesion, there is no sacral sparing. Early sacral sensory loss is there. So the correct option here is D, sacral sparing. Treatment of choice for Kawasaki disease is IV immunoglobulin. IV immunoglobulin. Kawasaki disease, IV immunoglobulin. The treatment of choice in Kawasaki disease is intravenous immunoglobulin. Borderline personality disorder is A. Chronic feeling of emptiness, B. Unstable interpersonal relationship, C. Grandiosity, D. Low self-esteem. Low self-esteem. Borderline personality disorder. Borderline personality disorder. There is, whenever there is a borderline personality disorder, is that there are unstable interpersonal relationships. Unstable interpersonal relationship. The central feature of borderline personality disorder is a pervasive pattern of unstable and intense unstable and intense interpersonal relationship, self-perception and mood. Patient make recurrent suicidal threat and a gesture, and a small proportion of patient carry out the act or self-mutilation like cutting or burning. Patient have difficulty in controlling their anger. They cannot control their anger and impulsivity. There is uncertainty about the personal identity. Borderline personality disorder, unstable interpersonal relationship. B. Indications for ECT are all. Which of the following is the most specific test for rheumatoid arthritis? Most specific test for rheumatoid arthritis. A. Anti-CCP antibody. B. Anti-IgM antibody. C. Anti-IgA antibody. And D. Anti-IgG antibody. It is anti-CCP antibody. Anti-CCP antibody are most specific blood test for rheumatoid arthritis. That is anti-cyclic citrullinated peptide anti-CCP antibody testing is useful in diagnosis of rheumatoid arthritis with high specificity. Present early in the disease process and ability to identify patients who are likely to have severe disease and irreversible damage. Anti-CCP antibodies have not been found at a significant frequency in other diseases to date and are more specific than rheumatoid factor for detecting rheumatoid arthritis. So the correct option here is A, anti-CCP antibody. True about tumor lysis syndrome are all. A, hyperuricemia, B, hypercalcemia, C, hyperkalemia, D, hyperphosphatemia. So the correct option here is B, hypercalcemia. In tumor lysis syndrome, there is hypocalcemia, not hypercalcemia. So the correct option here is hypercalcemia. True about tumor lysis syndrome are all hyperuricemia, hyperkalemia, hyperphosphatemia, except hypercalcemia. So the correct option here is B. The gold standard test for diagnosis of insulinoma is A. 72-hour fast test. 72-hour fast test. B. Plasma glucose level less than 3 millimole per liter. C. Plasma insulin level more than 6 microunit per ml. C. Peptide level less than 50 ppm mole. The gold standard test for diagnosis of insulinoma is supervised 72-hour fast test. Diagnosis of insulinoma requires demonstration of inappropriately high levels of plasma insulin, and C peptide in the presence of documented hypoglycemia achieved by 72-hour fast test. Absolute values of insulin or C-peptide are not reliable in establishing a diagnosis unless hypoglycemia is documented. The 72-hour fast test allows demonstration of hypoglycemia together with elevated levels of insulin and C-peptide. Elevated levels of insulin and C-peptide. So it becomes the most gold standard test for establishing a diagnosis of insulinoma. So the diagnosis of insulinoma gold standard is 72 hours fast test. 72 hours fast test. The gold standard test for diagnosis of insulinoma is 72-hour fast test. Urine analysis of patient with hematuria and hypercalcemia is most likely to reveal A. Isomorphic RBCs, B. RBC CAS, C. Nephrotic range proteinuria, D. eosinophiluria. Eosinophiluria. What do you think is the correct answer here? Hematuria is there, hypercalciuria is there. Urine analysis of patient with hematuria and hypercalciuria is most likely to reveal isomorphic RBCs. This hypercalciuria is a cause of non-glomerular hematuria. RBC from non-glomerular source more commonly resemble peripheral blood with isomorphic RBCs and absence of RBC CAS. So there are no RBC CAS. This is a non-glomerular origin. So they have isomorphic RBCs and absence of RBC CAS. So the correct option here is A, isomorphic RBCs. Examination. It's a metabolic or toxic etiology of delirium. In a drowsy and confused state, bilateral hysterexis is a certain sign of metabolic encephalopathy or drug induction. Hepatic encephalopathy can be suggested by hysterexis and can occur in chronic liver failure and acute pulmonary hepatic failure. So the most correct option here is A, hysterexis. Their detailed explanation. If you have any doubts, you can write in the comment box. You can directly WhatsApp me on 9483652020. I will be holding a special free masterclass which will help you to move forward and improve your preparation. You can click the link in the description box to join the specific WhatsApp group so that you can know the details of the masterclass. It is free 7 days masterclass. It will be highly beneficial. There are some amazing bonuses in the form of bonuses will be given, and it will be very helpful in your NEET PG or national exit test preparation. I wish you all the best. Happy preparation. Take care. God bless you.